Never met a girl like you before. It's BBC Hereford and Worcester. It's Malcolm Boyd and it's 8 minutes past 11. And you may have heard that it's Mental Health Awareness Week this week. But the thing about having some of these problems is that they can strike at any time. We can't really boil it down to a week. At the moment, of course, most of us are experiencing some sort of problems. Perhaps you could label it mental health problems, I don't know, in the lockdown caused by the coronavirus outbreak. It's a troubling time is what I'm saying. It's a testing time. It's a stressful time. So when we heard about the Worcestershire boss who's hired a mental health nurse to have on hand at any time to help his employees, we thought we'd like to know more about this. In fact, arguably, appointing this nurse is the best thing that Simon Lancaster, the chief executive of SJL Insurance, has ever done, because it's led to him saving the lives of 2 of his employees. Well, I've been speaking to Simon and one of his employees, Dan Ingram, and I asked Simon first, how did this come about? How did you get to employ Carie Workman, a mental health nurse, for the firm?
Well, we hired Carie, our mental health nurse, a year ago next month and invited all of our staff to discuss anything they wished to with her in private and confidential sessions. And I was initially unsure what the take would be like, to be honest, but we've seen over a third of our staff have taken advantage of the scheme, with Carie helping them with a wide number of issues, ranging from normal, relatively low-risk work or home life stress right through much more serious problems such as anxiety, domestic abuse, mental health illness, and even suicidal thoughts. And every single one of them has said that it has been fantastically beneficial, more than anything else they've tried previously. So we've been delighted to help them. But as a consequence, it's also been good for the business, with staff morale, attendance, productivity and retention all improving, as well as them probably becoming more connected to SJL. So it's definitely been mutually beneficial.
How does it work? If somebody needs the help of your mental health nurse, Carie Workman, how do they do it?
Well, they book in directly with Carie. Carie comes to our office, or she did before lockdown, but I'll come on to that in a second. She comes to our office 2 days a month, and they have private sessions with her in the meeting room, and it's all confidential. And then they also have follow-ups with her by phone. Now, when the lockdown started, I sat down with my senior management, like most businesses, and decided which commitments to continue with and which to suspend. And we decided to continue with Carie, sort of looking after the staff via video calls. And I'm glad that we did, because although we're one of the lucky businesses that have been able to continue to trade through the crisis with all of our staff working from home, we recognise that this is still an extremely worrying and challenging time for them, worrying about loved ones, managing the challenges of working from home, maybe loneliness, anxiety. Every time they turn on the news, it's death tolls and economic turmoil. So Carrie's really helped them through this with a range of measures. And we've even got staff with spouses and family members working in the NHS at the moment, so their levels of worry have been at an all-time high, and Carrie's helped them manage that. And we've even offered Carie to their NHS working family members. So it has changed how they access Carie, but it's still working well, thankfully.
So even though you took on a mental health nurse for the company before lockdown, in lockdown it's become even more important. Would you say that?
I think so, yeah. For sure, yeah.
Let's bring in Dan. Dan, good morning.
Good morning.
So as an employee of SJL Insurance, how would you say this scheme has worked for you and your colleagues?
It's done me and my colleagues a world of good, to be honest. I think it started off with a few of us going to see Carie, and there was always a bit of caution about it. People were worried that things would be fed back to senior managers, which obviously it doesn't. But I think after the first few of us got through the door and started using Carie, and we was asked for feedback saying, well, how is it? Is it good? What kind of questions does she ask, rather than how is it that she's helping? I think the feedback alone spoke for itself, and now the numbers are just increasing on a weekly, monthly basis. People who are keen to speak to her and see what help they can get.
And is it almost as if she's become part of the family, if you will?
It seems like she's been there forever, as daft as it sounds. I know it's been about 18 months, but it's like she's part of the foundation now. I couldn't really imagine Carie not being linked with SJL anymore. I know obviously it is an external thing, but it does feel like she's a staff member. She's there. She speaks to you as if she's a friend or family member rather than someone who's there to do a job. yeah, she definitely does fit in perfectly.
And in these testing, challenging days, how comforting is it to know that there is help remotely whenever you need it?
It's incredible, really, because as daft as it sounds, as soon as this lockdown was announced and we all knew we'd be stuck at home for the foreseeable future, a lot of people, including myself, was worried that Carie was no longer available, and it's once a month that we get to speak to her. But it's not so much just those hourly sessions you have with her once a month. She's available 24/7, so I could be fine on the day that I'm booked in to be speaking with her. But it's comforting to know that I can text her at 9 o'clock on a night when I'm sitting down watching the news, thinking this is all doom and gloom, just asking for a bit of advice to keep me calm or something along those lines. And Carrie's always available.
Simon, how much of a difference has Carie made, would you say?
I think she's made a brilliant difference to the individuals. She's certainly helped them through a wide range of issues, but like I say, she's also improved the business in terms of staff morale, retention, productivity, and the way they view SJL, and the buzz around the office that it's created. It's been mutually beneficial for sure. And
would you say she is key to your operation?
Yes, definitely, which is, like I say, one of the key reasons why when my senior managers and I sat down at the start of the lockdown deciding which commitments to suspend and which to keep, she was one of the key ones that we decided that we'd keep.
Is she a potential lifesaver?
Definitely, yeah. I mean, it sounds sort of melodramatic to say that, but from what I've seen with her work for the last year, definitely so, yeah.
That's Simon. He's the Chief Executive of SJL Insurance, and Dan, his team leader. We'll return to this story after the news at 12 o'clock. The Worcestershire firm that's employed its very own mental health nurse, and she is on hand 24/7 to the workers. We'll hear from her, Carie Workman, also after the news at 12 o'clock. It's always better when you do. Earlier on in the show, we heard the story, didn't we, of the Worcestershire boss who had hired a mental health nurse to have on hand at any time to help his employees. A change that arguably led to him saving the lives of 2 of his employees. To hear of a business having their own on-call mental health nurse. That nurse, as you've been hearing, is Carie Workman. And I spoke to Carie and I asked her how it all came to be.
Well, to be honest, I was doing a networking and somebody from Simon's company heard about what I was doing. So they asked for a business card, and then a few days later I had a follow-up asking if I could meet everybody. So I met Simon and some of his other staff, and through the interview process, Simon very much said, I don't really think I can see many people picking this up, but we will give it a go, definitely, so because I totally believe that people should get support for mental health.
And you've heard how important it is for the employees. How is it for you to be doing this work, Carie?
It's extremely important because with the tools that I can provide, I can go into Simon's company and be able to help people individually on a one-to-one basis. And it's very much that I still have to practice with my code of conduct with my nursing. So everything's confidential. And also it's not off limits. So if they are feeling stressed or anxious or low mood during the period that I see them, they can always contact me. They've all got my email and they've all got my contact number. And I do say, I'm not off limits. Please contact me, because I do not want from 1 month to the next people sitting at home struggling. I would rather them contact me because that's what I'm there for.
Carie, it sounds as if they think the world of you. What sort of things are you dealing with?
I'm dealing a lot with loneliness, social isolation. It's very having a negative impact. Being away from loved ones, there's a lot of stress, anxiety, suicidal thoughts.
Yeah.
So I deal with a range of issues relating to mental health, but luckily, because of Simon's help and support, that his employees are able to have the access from me, which I don't know any other company. I know one small company that continue to do this, but many other companies, they don't do this. They just have mental health first aiders or mental health champions who are absolutely doing a brilliant job, but they're not professional. And I do believe that it's great to support and help others. As a nurse, I'm able to go that step further because I've got the knowledge and I'm a professional and I've got the skills to be able to help and support and put tools in place.
And do you think it is something that other businesses will start to take up, Carie?
I hope they do. I hope that they can see from what Simon's actually put in place and the things that I do with the staff, that I hope that people sit up and learn and understand how important their staff's mental health and well-being is.
We've been talking to Dan, who's one of the employers, and he described you as, well, one of the family, really. Is it the same for you? Have they become your extended family because you deal with them on such a frequent basis? Do you know what I mean when I say that?
Oh, absolutely, absolutely. I love going into SJL. It's just a shame that I can't go in there because even some of the ones that I don't see, I still go up and have a chat to them. I ask them how they're doing, how their families are. I just love going into there. I love going into the office because the vibe, I just pick up off the vibe, and that's what I really like. And because I'm actually able to go into the office to see them, the atmosphere is just amazing. It's just brilliant. They just feel like just one big family for me, myself.
Well, I'll finish with Simon. Simon, it sounds to me as if it's good for individuals, it's good for the team, it's good for business, so it doesn't seem as if what you're doing has any losers, if you like. Would you encourage other businesses to do exactly what you've done and follow your lead?
Yeah, I wholeheartedly agree with that. It is a win-win situation for the staff, for us, hopefully for Carie as well. So we're just trying to raise awareness to try and encourage other businesses. I was speaking to one of my team the other day, and I said that the money that we spend on Carie is probably the best money that we spend. So I would certainly encourage other businesses to do it for sure.
How about that? The best money we spend. That's Simon Lancaster, Chief Executive of SJL Insurance in Worcester, along with team leader Dan Ingram, you heard from him earlier on, and the mental health nurse in question, who sounds lovely, Carie Workman. It's a decent idea, isn't it?
BBC Sounds. Escape to another planet with some of the biggest songs from the best sci-fi films.